to stop bleeding after a blood vessel, or if the skin has been injured. Eventually, the clot forms a protective seal over an injury. If the body did not have the ability to clot blood, people would bleed to death after just a minor cut. A deep vein thrombosis, which is known as DVT, is a blood clot in a vein. Blood clots in veins most often occur in the legs, but can occur elsewhere in the body, including the arms. The most common cause of a blood clot developing in a vein is immobility. A complication can occur in some cases where part of the blood clot breaks off and travels to the lung.
It happens more in women because of this biochemical change in the blood which render it hard. The condition is treated by having gradual compression of the limb, of the lower limb, for example, and heparin injection to keep the blood flowing and to thin the blood. And that's how it's treated. And people might end taking aspirin.
There are two distinct forms of clots. One is in the arteries and the second is in the veins. The arteries and veins are like two separate tree trunks, with the flow in the tree trunk going in the arteries to the feet and arms, and the one in the veins, the flow goes to the lungs. The arterial and venous flow goes in opposite directions. When arterial blood flow gets to the end of the limbs, it goes through tiny capillaries that keep blood clots from going into the venous side. Clots in the veins travel up the trunk to the end, which is the lungs. The lungs filter out clots to keep them from going back around to the arterial side. A large blood clot, if untreated, can kill the tissue distal to where it lodges in the limb. Arterial side, the feet, venous side, the lungs, and also can affect the heart if it is very large.
It starts usually because of stasis, of the blood is not moving fast enough, like say sitting in an airplane, or as well as common in women who taken the contraceptive pill. When I say common, it happened more in women who taken the contraceptive pill because the incidence itself is very rare, by the way, so people don't get very scared. As well as common in people who are obese, people who sit in chairs many hours, flying for many hours, and as well as common in women who do not breastfeed, and as well not uncommon after giving a baby.
Control pill, you have a lot of weight problems with it and it bloats you out. So I chose the Marine Corps because I have 5 children and it was a safer option for me because I'm a smoker as well. So it's better for me and safer. So I've never experienced any blood clots from any contraceptive pills or anything, so which is good.
Birth control pills and smoking don't mix after the age 35, so one must quit smoking before taking the birth control pill. Birth control pills will increase the body's tendency to form clots, so that someone who's already prone to do that, it's going to make this problem much worse. Since the birth control pill increases the clotting ability of blood, it's generally not recommended or requires close monitoring by a doctor for an overweight person, or if one has inherited blood clotting disorders or have a history of DVTs. The risk of clotting also increases with larger doses of estrogen, so it's recommended that women use as low a dose of estrogen as possible. An analysis in a recent study stated that the risk is very small and similar to risks that are usually accepted as part of living. The information makes it possible for women and their partners to decide if the risk is acceptable to them. Also, oral contraceptive users had over 2.5 times the risk of ischemic stroke compared with those not currently using oral contraceptives. Many women rely on oral contraceptives as a birth control method. Birth control pills are usually safe for most women. However, they do carry some health risks, especially with smoking, which will increase a woman's risk to a stroke. Hiba Isam for the Saudi Morning Program, London.